So let's take some time to study the laws of spinal mechanics, or Fryette's laws, as they pertain to the cervical spine. I highly suggest you watch this segment several times before attempting these techniques on a colleague or client. The big picture with respect to Fryette's laws and spinal mechanics of the cervical spine is that, in essence, there is rotation in side bending. As it pertains to the cervical spine, cervical vertebrae 2 to cervical vertebrae 7, Fryette's laws states that in a neutral position, side bending to one side, for example, side bending to the right side, is accompanied by rotation to that same side. So that means that when you are in neutral position without flexion or extension and you side bend to your right, the cervical vertebrae will rotate in this direction, what we call right rotation. Now that you know about spinal mechanics, you know what might be happening if you ask your client to side bend to their right or to their left, and there is some limitation in their side bending. So if you have a client with limitation in left side bend, for example, then you know that it's possible that there is a vertebra that is right rotated. Also, if you have your client look over their shoulder, over your right shoulder and then over your left shoulder, and there is limitation in looking over their left shoulder, that might indicate further that there is rotation in one of their vertebrae. It's important to note that it's usually not a clear-cut case where there is one vertebra out of place. It's usually what I call a symphony of rotation.